So I think, the biggest supplement that gets talked about is fish oil. The idea of using fish oil came from studies where they showed that certain groups in the Arctic who were primarily fish eaters had much lower rates of heart disease than people who consumed like a Western diet. So the thought was that fish oil for heart disease could be very important for heart disease prevention. But recently, there was a big study, and this came out about a year ago, that actually showed that there was no benefit in reducing cardiovascular disease, so heart attacks and strokes, with the use of over-the-counter fish oil. The same for vitamin D. For heart disease prevention, it hasn't been shown to play a role. One of the common supplements that we see a lot of people using is something called red yeast rice, which is basically a natural form of statin.
Fiber supplements may help lower high cholesterol. In particular, look for options that contain soluble fiber.
The issue with all of them is that they're not FDA regulated. What I tell people is, listen, if you found something that's works for you, we'll take a look at the ingredients. We'll make sure there's nothing overtly harmful, knowing that maybe we don't know everything that's in this particular pill. And if you really feel like the benefit to you is great, and we don't seem to have a big risk here, then there's no harm to taking it except for the costs, and some of these supplements are extremely costly. But I'm very clear about the fact that none of these over-the-counter supplements have been shown to reduce their risk for heart disease, which is basically the biggest thing that we're talking about. If there was a supplement for daily exercise, then I would certainly have people take that because that's helpful. But, unfortunately, the idea that some pill is going to prevent them from having to take a cholesterol-lowering medicine like a statin or fix their risk, it's probably not true.